Nada, you're still on mute.
Whoopsie. Looks like we have people joining us. That's great. I'm going to wait just a little bit, just a minute or so to let people pop on. I think I'm going to go ahead and get started. We still have a number of people that did register that have not yet signed on, but I don't want to delay us too much so that we don't have time for our speakers and presentations today. I want to welcome everybody to this Innovation, Equity, and Exploration webinar series. I'm really excited to hear from the people that have worked really hard this year and looking at different Voices for Healthy Kids issue areas and the work that they've done around that. But I'd like to first, again, welcome you, but then introduce Susan Moran, who's our facilitator for today, who's done a great job in helping lead and guide me as well as we've done this planning. So for all of you, just to let you know a little bit about Susan, she's the Director of Operations for the consulting firm My Power People. It was founded in 2018, and it helps clients advance their mission through policy advocacy and community engagement. Prior to joining My Power People, Susan was an associate with the New England division of M&R Strategic Services, so she knows Lori Frasina, our executive director, very well. Susan has extensive operations and business management experience and has dedicated much of her career to working in the nonprofit arena, collaborating in strategic action planning, research, community organizing and engagement, and grassroots mobilization and training. Susan lives in Lexington, Massachusetts with her family. She's an active member in her community and volunteers for Meals on Wheels and Cradles to Crayons. Susan also founded the Build Our Kids Success exercise program at a local elementary school and holds a Bachelor's of Arts degree in psychology from Loyola University in Maryland. Let me welcome Susan and our presenters.
Thank you, Nada. Before we hear from our speakers, I wanted to provide a quick overview. Each speaker will present for 15 minutes, followed by a 10-minute question and answer session. Please remember to keep your lines muted and use the chat box function to submit your questions. We will do our best to get through as many questions as possible during the Q&A sessions. Today's webinar is being recorded, and we can share the link and the speaker presentations with you. Now it is my pleasure to introduce today's first presenter, Brandy King with Child Care Aware of America. Brandy?
Thank you, Susan. I hope everyone can hear me. And I'm going to admit this is actually my first Zoom webinar, so I hope that I don't break the system while we're on here. But it's my pleasure to talk with you and to share a little bit about our Voices for Healthy Kids Early Childhood Education Issue Advocacy Coalition. So as mentioned, I am Dr. Brandy King, and I serve as the Deputy Chief of Programs at Child Care Aware of America. And I'm so excited, and I have the wonderful opportunity of guiding our health policy work as well as our training and technical assistance efforts at CCAOA. At Child Care Aware of America, we are committed to public health that impacts children and families, and through our health policy work, where primarily we focus on health equity, nutrition, physical activity, as well as workforce wellness. And I could not move forward without sharing that we've been very privileged to work over these past 3 years with our American Heart Association Voices for Healthy Kids partners through funding by the Robert Wood Johnson Foundation, in which they've helped us to build partnerships with 10 amazing organizations who focus on efforts that help us to increase access to healthy foods and encourage more time for children to play with their families, participate in healthy activities. In supporting our work through our ECE Issue Advocacy Coalition, and I'll be sharing IAC moving forward, it has been really easy for us to work and continue to align our work because our coalition is on the same compass path to work as we are at Child Care Aware of America. Child Care Aware is an equity-driven organization that remains focused on efforts that are child-centered and family-engaged. Through our networks with child care resource and referral agencies and the Voices for Healthy Kids Coalition, we promote efforts that are community focused as well as those that focus on having a real impact. We use a variety of venues to share our messages, such as webinars, resources, as well as virtual, especially in today's times, virtual training and technical assistance, as well as pushing local and federal advocacy efforts. This year, as we all know, the world experienced a crisis that no one was prepared for, COVID-19. And many families, communities, and businesses in this country were forced to abruptly change their course of pace. We were forced into a world of uncertainty. Schools closed, nursing homes prohibited visits from loved ones for their residents, and states established curfews to try and slow the spread of the virus. But even before COVID-19, our childcare system was broke, and that was why we are on this path to really working together and moving our work closer. Because this virus decimated our world as we know it today, we have been on a trajectory of really reimagining what childcare looks like and pushing our work forward so that everyone can have more access to healthy, quality childcare. So as a result, I want to share that our organization will share through a resource where we'll be exploring the damaging effects of COVID-19 in our new fall report, Picking Up the Pieces. In it, we compare 2019 data about childcare that we've collected as recently as July 2020 to show how the virus has affected the supply, affordability, and quality childcare. I'm excited because in this report, it presents data, analyzes it, and offers a perspective of the economists about the future of childcare. It also features case studies and stories from not only childcare providers and families, but through our partnerships of our IAC, so to show how all families and providers have been affected by the virus. Our report is broken up into 3 parts, and this is important because they are impactful for our compass, that equity-driven, child-centered, and family-engaged levels. And those 3 parts are there's state-level data and visualizations that tell stories about childcare issues. There are state fact sheets that highlight how centers are impacted by the crisis, and there's a narrative of those, what we call stories of providers and families and those on the local front about how they were impacted and affected by the pandemic and the findings that we gather from surveys and research. So please look for more information to come, as we'll be sure to share this out with all of our coalition members as well as all attendees in today's webinar who are interested. I also want to share a highlight of one of our partners, the Food Research Action Center, or FRAC, who will be partnering with Child Care Aware of America's Emergency Child Care Technical Assistance Center. We are having a webinar tomorrow, and this is just the shining of our coalition members and all the work that they do. But there's a webinar tomorrow, Friday, September 18th, from 1 to 2 p.m., and the webinar focuses on the Child and Adult Food Program, or CACFP, and how it can help ensure that children are fed healthy meals and snacks, that childcare businesses remain financially sustainable during and beyond COVID-19. We hope that you join us, because as a part of our coalition membership, our partners at FRAC have been pushing and working with the USDA and the CDC to impact policy and practice updates related to serving preschool as well as childcare age children during COVID-19. They have supported and studied how CACFP can serve those school age children as well as early care children. And they will be talking about waivers for monitoring visits and other issues during COVID-19, and really talking about those expectations and best practices. So we're excited because our coalition members will be presenting those policies and best practices on how we respond to questions from the audience. So please look forward to that, and I hope that you can join in with us. But that's just the tip of the iceberg for all the great work that our coalition members have done over the past year and will continue to do. And now I want to share a little bit about that direction, or how our compass is moving us, by showing the focus of our Issue Advocacy Coalition. The purpose of our Voices for Healthy Kids Early Care Education IAC was to assemble a diverse set of stakeholders and subject matter experts who work interdependently to advise states pursuing public policies that support not only healthy eating, but also physical activity in ECE settings. In addition, our IAC influences ecosystems through the systems and environmental lens in which programs operate, in particular by supporting healthy eating, the physical activity, as well as screen time standards implementation at the local and state level. Our coalition continues to focus on those policies that support state, tribal, and local efforts, including those like Head Start and Early Head Start, and which we'll hear a little bit about later, as well as other high-quality licensed childcare for children from low-income and often under-resourced families. We encourage childcare quality through improved nutrition and screen time standards, as I mentioned, but also trauma-informed care for providers as well as children and families. We work on advocacy efforts in our coalition that encourage the following. We hope to encourage nutrition standards that are consistent with the current CACFP patterns. We encourage sugary drink standards that are consistent with healthy eating research recommendations, and that includes no sugary beverages or no juice for children under age 2, as well as monitoring the juice served in specific portions for children each day. We encourage physical activity standards that must be consistent with the YMCA's healthy eating and physical activity standards, which include opportunities for moderate to vigorous exercise or physical activity for at least 60 minutes for full day and 30 minutes for half day programs. And I'll just add here that that's extremely important given our potential for sedentary standards right now during a pandemic. We also offer and encourage opportunities for tummy time for infants, as well as those screen time standards. We continue to push and work for those. Our coalition has been, in particular, very privileged and successful in making recommendations in which those standards are met exploring the impact of affordability and accessibility of childcare, as well as being in discussions with the other ECE advocates to strategically align principles of policies that impact advocacy for all children and families. And then we also continue to work with children, with programs that support children in all communities so that they can benefit from our Voices for Healthy Kids policy initiatives, regardless of where they are and where they live. So now I'll show you the efforts of our coalitions, and let me introduce you to our members. I'm excited because we have so many wonderful members within our coalition. As you can see on this screen, and I'll start in the top corner, you'll see in this screen that we have members from the American Academy of Pediatrics who support broad health and welfare work, as well as looking at newborn screening and other components within their scope of practice. We partner with the National Head Start Association, and you'll hear more about their work later, but they have focused on Head Start and early Head Start, public health, as well as maternal and child health. We partner with the National Black Child Development Institute, as well as, in particular, those from the Philadelphia and vicinity area, where they focus on HEPA and healthy eating and nutrition, as well as food advocacy. We have a partner with the University of Delaware through their Department of Behavioral Health and Nutrition, the Public Law Center at Mitchell-Hamline School of Law, as well as I mentioned, the Food Research and Action Center, or FRAC, who focus on nutrition, food insecurity, in particular federal food programs such as WIC or CACFP. We have great members through 0 to 3 who focus on policy and early care and education, as well as the UNC Chapel Hill through the Center for Health Promotion and Disease Prevention. We'll talk a little bit about their work. Nemours Children's Health System, who focus on food and nutrition, as well as Moms Rising, and they focus on early care and education and racial equity, and they have been very successful in grassroots convenings campaigns throughout the nation. And as I see my time is quickly coming to an end, I'm going to now share a few highlights about our coalition's work, and I'm going to share from the following partners. First, I'll talk about the University of Delaware. Our coalition member, Laura Lessard, actually over the course of this year worked very diligently with our Child Care Aware of America team to publish a peer-reviewed article in the Public Health Review entitled "The Health Status of Early Care and Education Workforce in the USA." This study focuses on a number of more than 2 million ECE providers that learn low wages and are also enrolled in public assistance, and they studied what are the health outcomes and health implications through that. I encourage you to look up this study, and we can share this resource out, as they've done a great job really focusing on the health and looking at policies that can enhance health for those providers. Additionally, this team has been working with over 138 preschool programs in Philadelphia to access their fresh and clean water by children. Clean water for children. By February of this year, they had surveyed all those programs and interviewed several, but unfortunately, due to COVID-19, they had to cut their interviews because they were face-to-face. But I just want to share that as an outcome of that work, they really laid the groundwork for expanding water access throughout Philadelphia and potentially the entire state of Pennsylvania. So I want to just commend them for that hard work, and we know that they're going to get back to it soon. Lastly, I'll share that our partners at the University of Delaware were instrumental in supporting Delaware through their licensing rules as they were establishing waivers and really trying to encourage childcare programs to remain open and remain safe during coronavirus. Another partnership that has occurred through our members is between Nemours and the University of North Carolina through the NAPSAC project. And first, I'll share that as a part of the Nemours Project Hope this summer, Nemours provided stipends of $5,000 to each of their 4 Hope states: New Jersey, Florida, Oklahoma, and Washington. And those stipends were to support food security efforts in the midst of COVID-19. States are using those funds to target the needs of children and families in those communities. Nemours also partnered with UNC through what's called the Go Knapsack. It's an online platform for promoting healthy childcare. We're so excited about that online resource. You can find that at their website because they're able to continue that work through this pandemic time. I'll also share about the partnership between 0 to 3 and American Academy for Pediatrics. Many of you may have learned and heard about the Think Babies campaign, but this is a huge campaign that is really tried to advance the infant toddler policy agenda, in particular to focus on early care and education, access and quality for children and families. Every year on the Capitol of the United States, they have a Strolling Thunder event. It's a huge advocacy event in which they help support states, families, partners, go and push policy, and really they've asked for more funding through the CARES Act and through their congresspersons in their states. The event became a virtual event this year, which also has had a huge impact. I just want to share briefly that through the partnership of AAP and 0 to 3, they worked with New Jersey, Georgia, and North Carolina in partnership to support the Right from the Start campaign in New Jersey, where they pushed the importance of childcare not only through research, but also through policy. In Georgia, with their partnership through the Georgia Early Education Alliance, they have, for Ready Students, they've pushed webinars for home visiting, as well as webinars for legislative infant toddler studies. And then in North Carolina, they increased, which is a huge win, they increased childcare subsidy rates and paid leave for state employees. And lastly, I'm going to hand it off to our partner, Kent Mitchell from the National Head Start Association, but I just want to highlight that they've also been extremely busy over the course of this past year. And if you have seen or part of their resources and they're emailing out, they actually released their Destination Reopening Playbook, as it was designed to spark the thoughts and efforts for those reopening Head Start and early Head Start centers following COVID-19. So I apologize that I rushed through those last few slides, but I just want to thank you for your time. And if you have any questions, feel free to ask them at your convenience. Thank you so much.
Thank you, Brandy. We would like to open it up now for questions. We have about 10 minutes. If anyone has any questions for Brandy, you can submit them through the chat box. We can wait a couple minutes, and then if no questions arise, we will move on to our next presenter. Well, okay then. Why don't we introduce our next speaker? Oops, there's my timer. Kent Mitchell is with the National Head Start Association. Kent? Kent, yeah, you're on mute. Hi, Kent, you're still on mute.
Can you hear me now? Can you hear me?
Yes, thank you.
Okay, perfect. Sorry about that, everybody. Thanks for your patience. Yeah, great. Well, thank you so much for this opportunity. I'm Kent Mitchell. I'm the Director of State Affairs for the National Head Start Association. And thanks, Brandy, for such a great presentation. And a shout out to NHSA as well. We appreciate that. Thank you. So our coalition, like Brandy's, is focused on early childhood education. Head Start covers the prenatal to 5 years. But we've really been focused on expanding access to early Head Start and Head Start programs for more at-risk kids and families. That's been our big goal, especially increasing access. So I'm going to focus a little bit on that today, and you'll see a great one of our kiddos right there from one of the centers there. So we love our kids and families. Our focus of our coalition has been kind of fourfold. And the first piece has really been to build a national level commitment through this great coalition that we've assembled of 23 organizations. The second, I apologize for the number here, the second is to expand knowledge and support for two main things. Like I said, direct state funding for Head Start and Early Head Start. Most of what Head Start does is funded by the federal government, serves 1 million kids that way. But we need a lot more funding to access all the at-risk children who need high quality services and supports. The second piece there in policy is around effective collaboration in states and things that can accelerate and improve that. We also want to expand the understanding of the health benefits of Head Start and Early Head Start. Those get a little less attention than some of the academic and other benefits, so this was a great opportunity to focus on that. And finally, we've been spending a lot of time lately on empowering stakeholders to take action, really arming advocates with information and other things. So taking our coalition work and taking it a little bit public so we can arm and empower other people. I did want to mention, of course, like Brandy, our work is supported in part by Voices for Healthy Kids, an initiative of AHA with support from the Robert Wood Johnson Foundation. And I've listed here a number of things that's allowed us to do, so we're really grateful for that support. Just in brief, and I'll go briefly through these intro slides, NHSA really is the Head Start community. We represent, we're the voices for the 1 million kids, 270,000 staff, and thousands of programs in all 50 states and territories. Specific to this work, I work with our 50 state Head Start associations. We have an advocacy presence and professional development presence in every state and territory. And those are my key stakeholders, folks that I work a lot with. For those who don't know, Head Start was started in 1965, turns 55 this year. So Head Start was really linked with the war on poverty of Lyndon Johnson's agenda and also with the civil rights movement. It was really a response to segregation in education, to racism, and to intergenerational poverty. It had a particularly pronounced focus on Southern states and Black children and Black families. We're really proud of the legacy of Head Start, and it's only succeeded and been around this long because of the voices of parents in particular and the voices of communities. One really important thing I learned that I like to share with folks is Head Start is federal funding that goes directly to community-based programs, and that is based on our history of state governments not being open right to desegregation. And so it is a really important construct of the program, and we're really proud of Head Start's longstanding history on being community-based and community-focused. For those who don't know much about Head Start, it's all about families. We focus on children, but also the whole family. We serve the most at-risk children in any given community. We provide comprehensive services, including health services. Like I said, it's really community rooted. It's based on community need. What do folks need? And parents, this is really important. Parents govern programs through policy councils at every Head Start program. So they're really part of shaping their child's future and their child's destiny. Head Start today, you see the map here, a lot of little dots to look at there. But Head Start, again, is ages 3 to 5, early Head Start, prenatal to age 3. We are all over the country, as you can see, all over every territory, million children and families. And we have specific programs to address inequities for migrant and seasonal children and American Indian children as well. Head Start, right? I talk a lot about the history, but Head Start is booming. Head Start's bigger than I believe it's ever been. And we're responding to COVID-19. Programs never closed during COVID-19. They stayed open, they innovated, and they continued to serve children and families in new ways. And you'll see some folks doing food delivery here and also dropping off educational kits. Head Start's also there again for our most at-risk kids. It really is responding in states to rising rates of foster care in states. Foster care children are categorically eligible for Head Start. They're automatically in. It responds to family homelessness, which continues to be a real stain and an issue in our country and in our communities. It responds to childhood trauma, right? And I know we're going to hear a lot more about much more focused work on that from other voices efforts. but it's specifically designed, and our programs are very much becoming, or if they're not already, trauma informed. Bottom line, and I have to say this because I work for Head Start works. I must make that clear. Every Head Start program is a little bit different, but they're all grounded by a unifying framework and a set of comprehensive services. And what we find is that Head Start, on average, produces stronger families, improved health, and greater economic self-sufficiency. And it gets kids ready for school and for life. So we're really proud of the impact Head Start has had. But here's the rub, right? And here's the story, right? Why the coalition comes in. Too few children who need Head Start get Head Start. You'll see here that only 1 in 3 income eligible preschoolers are reached by Head Start, and only 1 in 10 children who are aged birth to age 3. Now, states do fill in some of that gap with state funding through Head Start or through other programs, childcare and others. This is specifically around the poverty, eligibility, but there's a huge gap in every state between the number of kids who can benefit from comprehensive services like Head Start and those who are actually reached. And that gap, is most pronounced among infants and toddlers. And so that is a huge gap and need area. So good thing, right? Governors care a lot about kids, right? It doesn't matter if you're Republican, Democrat, whatever. I mean, everybody cares about children. And so it's all about working with governors and working with states and their early childhood systems to expand access to Head Start and early Head Start. That's been a big focus of our coalition. So like Brandy, I wanted to highlight some of our coalition members here who are tremendous. And you'll see, sorry, I meant to say at the top of the moment here, if you see a blue circle there, that means something we've delivered as a coalition or something we've done. I wanted to try to use that as a kind of a marker for you to note where we've done things. So obviously I'm not going to read every coalition member here because I want to get to some more of the meat of what we've done. But some of our coalition members are on the call, including Childcare Aware. 0 to 3 has been a great partner. American Academy of Pediatrics. So many folks have been amazing partners. We've done monthly meetings, and we also mapped our coalition assets too. I believe most coalitions for voices have done that, learned a lot from that process. We saw who was really strong in advocacy, who was great at events, who was good at research. And that's really helped me understand the assets of our coalition. Like I said, we've been doing more sharing with the public. We actually started a 3-part webinar series in July of this month. And we're on our 3rd webinar, which I hope you can attend. If you're interested, let me know. It's going to be in October, and it's our 3rd of our 3-part series. We're really trying to walk folks through a few things. The first series was really all about how Head Start's relevant, how it's responding to need today, especially during COVID-19. The second was all about policy solutions, state funding for Head Start, as well as collaboration. And then the third one, which we're going to get to later next month, is exciting because it's all about advocacy. How do you move an agenda in states? We're going to talk to 2 great campaign teams from Idaho and from Oregon about how they've been successful in that work. So like I said, there's really 2 options for states. I mean, it's a little more complex than that, but I try to distill it down to that, which is you can fund more slots for children to go to Head Start and early Head Start as a state, or you can promote and work on collaboration so that Head Start's tightly integrated, health services are integrated, partnerships are happening, referrals are happening as needed, right, for kids. There's a lot of things states can cover there. And a lot of those collaboration things, as you can imagine, are 0 to low to no cost things. And I'm getting a little chat there. Okay. So our focus has been on direct funding. It's to supplement the federal funds. We put out a great issue brief on that. It's one of our signature products as a coalition. You can see the link here when you get the chart, get the slides. It's about those state investments. What we found is that 14 states invest about $400 million every budget cycle in Head Start and early Head Start. And so you'll see that there. Our goal is to have every state do this. And I like to say in the report, a little bit goes a long way. Not every state has to invest at a high level. We know Pennsylvania, for example, gives about $50 million a year, which is huge. But we have states who do a few million a year to expand care for infants and toddlers. Every state, we believe, should be doing this. And that's something we've aligned around as a coalition. For the sake of time, I think I'm not going to go through each of these examples, but expanding access is a huge reason to fund Head Start. To meet the needs of working families, you can extend the day, the number of hours folks have access to these great programs. You can also support teachers and increase compensation for the workforce, who is often underpaid in early childhood. We put out a nuts and bolts memo. I'll talk about that just real briefly here. For those who are ready to take the next step and be advocates and advocate for state funding, we put out a more detailed description of how you might go about doing that, what the legislative or budgetary language might look like. And collaboration, I'll cover some of those. We've got an issue brief coming up in September on that, which I'm excited about. It's a second issue brief for this coalition. And it's going to focus on, again, the low-cost things that are really about redirecting funds or aligning opportunities. That can be everything from making sure kids are in the right program, whether it's pre-K or Head Start, or vice versa. It can be support for infants and toddlers and standards there. It can be working with foster care systems to make sure that they're aligned with Head Start. It can be health. It can be expanding health opportunities as well. Like I said, health is really huge for Head Start. You'll see a long list here of all the things that are required of Head Start programs for health. Really proud of that legacy as well. Like I mentioned, there's a real tie-in to trauma and those issues as well, heart disease, long-term, etc. So we're going to be sharing more as a coalition about the health benefits. Finally, I wanted to share that empowering stakeholders has really been key for us. We did a capacity survey of our state Head Start associations, and I just put a few findings here, but this really helped me, and I hope the coalition too, kind of understand where is each state in terms of their ability to move an agenda as the association themselves, where the partnerships need to be stronger, and we found there was a lot of work to do there in particular. And then finally, this last piece is coming, and I'm excited about before our coalition wraps up, is a data guide that we can give to advocates in states and walk them through a process to establish need in their state for Head Start and early Head Start. So again, we really want to empower them to make the best argument that they can, but we want to guide them in that approach too. What kind of data to use, why use it, how might you visualize it and present it, things like that. So that's the presentation, long and short of it. It's been an amazing experience, and I want to particularly call out the opportunity and the guidance of Voices to focus on equity. Head Start's deeply grounded in equity, but it's a journey, not a destination, so we're always getting better at it. And in these times too, with Black Lives Matter and other opportunities, we're becoming more anti-racist as an organization, and the equity work is helping us with that too. So I just wanted to call that out, and happy to answer any questions.
Thank you, Kent. I just want to remind everybody that you can submit your questions through the chat box. We did have one question come up for Brandy, so I'm going to pass this over to Nada to share that question.
Yes, Brandy, you know, there was, both of you, thank you so much for your presentations. Brandy, in talking about some of the work that Child Care Aware did, the question was, do you have an example of a policy recommendation that was provided by your organization this year to better enhance future ECE policy work? I know that you had some, and I just wondered if you wanted to speak to that a little bit.
Oh, that is a good question. Yes, we do have some examples, and I think I will focus on increasing supports for the workforce. And so we have, we supported policy that impacted workforce wellness. So to increase the amount of physical activity for those who work within programs to help them increase their activity, and then increase the activity for young children within those programs. And also our coalition has been instrumental in supporting policy that has increased water access within schools, as well as early care programs, and supporting that in communities. And so those are just two policies that we have been supportive of. I hope that answers the question.
Thank you.
Okay, thank you. So next up, we have Craig Massetti with the Public Health Law Center. Craig?
Thank you, Susan. And actually, I did see a question come through the chat for Ken. So I don't know if, I think it just came through. So I don't know if we want to hand that.
Yes, that would be perfect. We do have a question for Kent.
Yeah, I see that there. I can read it. Yeah, it says, Kent, would you be able to talk a little bit more about the data guide? And is this something you can share? Yeah, absolutely. It's not ready yet, but it'll be ready by the end of October. But in a nutshell, right, in our signature report about state funding, we tried to use the framing and have been pushing the framing to help state stakeholders understand what we call the rising tide of need for Head Start and early Head Start in states. So that can be rising rates of foster care. It can be persistent and chronic family homelessness. It can be rising rates of recognized childhood trauma and abuse. So using that frame, what we've done is start the conversation and start the process with a firm to help put together a data guide that looks at aligned indicators and data that would be aligned in states and communities at the lowest level possible, ideally, to that narrative. So we want to match the narrative, which is so important in advocacy, to the information. So what the data guide is going to do is going to outline how to make the case, right, linking to that rising tide messaging and argument, and direct folks to the appropriate data sources, how to interpret that data, how to visualize that data, and put together a case for themselves, right, for their state. It's not like these things don't exist. I mean, there's wonderful groups on our coalition who have just reams of data. I'd say the difference is that this is going to be very, very, right, Head Start and early Head Start focus. So, for example, Head Start's got that. If you're a foster care kid, you're in, right? If you're homeless, experiencing homelessness, you're in. And so we want to direct and guide our data toward that. So that's what the data guide's going to do. It's going to be something we can hand to folks and empower them. And yeah, I'd be happy to, of course, be sharing that with the Voices team, and they could always get that out to you all too.
Great, thank you, Ken.
Great.
Okay, why don't I share my screen? No. There we go. Can you all see that? Great. Thank you, Susan. And thank you everyone for joining today. Thank you, Ken and Brandy, for your great work and your leadership and your presentations. So both Ken and Brandy touched on this issue of child trauma and adverse childhood experiences, and I've had the pleasure of leading IEE special project work group that's really been about trying to dive more deeply into this issue, issues of childhood abuse and neglect, adversity, other forms of trauma. We know over the past 20 years of work that these things matter for health. They alter the course of healthy child development, and they have a lasting impact on health. And so our IEE, through the support of Voices, was able to really look at this issue through the lens of how to move early care and education as a system to become more trauma-informed. So my name is Craig Massetti. I'm a policy analyst at the Public Health Law Center. And for those who haven't worked with us yet, we are in St. Paul, Minnesota, based at the Mitchell Hamlin School of Law, which is located on the lands of the Dakota people. And we're a team of attorneys and policy experts and analysts who work nationwide to help communities develop policies and laws that are grounded in community evidence and solid legal principles. And we have a particular focus on trying to reduce chronic disease and promote health equity. So on this point of health equity, we're really committed to this, and we're committed to partnering and working with groups like Voices who are really trying to advance health equity. And And for us, it's about using the power of law and policy in a way that meets the specific needs of communities, especially those who unfairly bear a greater burden of health challenges and social harms. And this is really why we are really interested in working on ACEs and trauma, and why we were grateful for the opportunity to work on this issue and lead this work group. And we have been working on improving access to healthy food and helping people be more active and kids be more active and preventing commercial tobacco use. But for us, we have come to learn that those issues are all fundamentally intertwined with issues of trauma and childhood adversity. And so on this point of why we really thought this was an important issue to explore is because they're common, first of all. So about half of kids have experienced some form of childhood adversity or trauma, whether it's abuse or neglect or various household challenges. We know from recent research that they're costly. They're costly in terms of the impact that they have on health, and as well as socioeconomic circumstances. So these figures are what the percent reduction in health conditions or health risk behavior or socioeconomic challenges that would occur if we prevented ACEs. And so as you can see, there'd be a massive reduction in things like depression and other chronic diseases, things like recurrent smoking and heavy drinking and unemployment. Addressing the root cause of many of these issues, things like trauma and ACEs, would go a long way to preventing these challenges. And we also know that ACEs and trauma are costly in a healthcare sense. So these are data from the state of California, which show healthcare spending that's associated with health risk factors and chronic disease that are linked to ACEs. And so as you can see, this amounts to billions of dollars every year. And perhaps most importantly, we know that ACEs and trauma are really fundamentally a health equity issue. In this slide is an example of how Black, Indigenous, and children of color are more likely to experience ACEs and trauma, and they're also more likely to experience more of them. And so this is an example from American Indian compared to non-American Indian in the state of South Dakota. And what you see is the prevalence of many ACEs, things like abuse and neglect, are double or more than double compared to non-American Indian populations. And so really, these are issues that are at the root of disease and social problems and really early death. And on this point, we know that when you prevent ACEs, you expand lives by up to 20 years. And that's critically important. And so when it comes to advancing health among all people, but especially Black, Indigenous, and children of color, addressing ACEs is really important. And so, as I said, we've really been grateful to have this opportunity to convene an IE work group to look at the issue of ACEs and trauma, particularly how we can leverage ECE as a platform to become more trauma informed. And as a group, we wanted to first, of course, assemble the right mix of expertise and lived experience on these issues, and look at issues of programming, providers, and access in ECE, and what are some of the intersections and opportunities to address trauma in those three areas. And then also incorporating lessons from others. Kent had talked about some of the great work that Head Start and Early Head Start has done to address trauma. These are really important lessons that we can tap into, cross-pollinate with the other IEE that's focused on children's mental health, and Alexis will talk more about this after my presentation. And then we wanted to, of course, hone in on specific areas of policy. And so first, a quick thank you to all of our work group members. We've had folks from a variety of organizations who work at the community level, who implement programs, who work at the policy level, those from public health and childcare, and others. And as I mentioned, there's been great work that has been happening across a variety of settings, including Head Start and Early Head Start in schools, healthcare, other community settings that are moving and becoming more trauma informed. And these are really important lessons to draw from, and we tried to draw from in what we've been thinking about in terms of recommendations for ECE. Of course, our thinking has morphed and evolved amidst COVID-19, and really as everybody trying to think about how we navigate the issue and think about policy opportunities amidst a changing landscape, both in terms of ACEs and trauma, as well as ECE. And so the COVID-19 pandemic has really challenged existing systems that address things like abuse and neglect and ACEs and trauma. But it's also, of course, introduced a lot of new sources of trauma, large increases in unemployment and homelessness and food insecurity and all these things. And so thinking about how various systems can adapt to address them. And then Brandy spoke to this. I think the ongoing challenges of the childcare system and really the uncertainty of ECE and what that looks like. And in terms of reimagining childcare, it's been sort of a moving target for us as a group as well. In terms of talking about some of the policy areas that we've been thinking about, just a couple caveats before I jump into this. One is that this is still a work in progress. Our group is still ongoing. And so these are some of the issues that have kind of risen to the top, but we won't be wrapping up our work until later this fall, where we're going to be releasing a final report with detailed recommendations. And then second, and Brandy talked about this, but just the challenges of the economic stability in the ECE system. And so there's a lot of those policy recommendations and policy issues that, of course, have an impact on how ECE can be trauma informed. I'm not going to talk about those things around access and workforce development and staff wellness, and those are all critically important. So I'm going to focus on these four areas. The first around the ACEs framework being an overarching point, the next two being more kind of policy issue areas, and then the last point is more of a caution in terms of thinking about policy. So this is the sort of traditional ACEs framework, and when we think about ACEs, these are the 10 factors that are included in that. And I think there's really a need to broaden that idea, and I think there's been a lot of movement in trying to think about trauma in a more holistic sense and consider the variety of experiences and environments and how those shape kids. And in particular, highlighting many of these community factors that disproportionately and uniquely affect Black, Indigenous, and children of color, which weren't really part of the original ACEs framework. And as we know from our ongoing conversations as a country around racial equity, these are really important issues, things around poverty and discrimination and violence. And so trauma in many ways and broadening this framework is really about addressing these ongoing and systemic barriers. And this has been elevated as of late into much more of a national conversation around why racism is really a core determinant of health. And this quote is from a policy statement from last year from the American Academy of Pediatrics, which really recognized racism is a critical health determinant and as well as a contributor to prevailing health inequities. And how this plays out in early care and education, as well as other settings, is really through biased exclusionary discipline is one way. And so when you look at things like expulsions and suspensions in ECE settings, they disproportionately are experienced by Black preschoolers compared to white. And so this is really a critical area where we can learn from Head Start. Head Start has had a policy where it prohibits the expelling or unrolling of children from Head Start. And so as Ken talked about, it's really about partnering with families and helping the child and family when there are child behavioral issues that happen. And so I think this is an important lesson to draw from and think, and I think we need to think about how this translates into other ECE settings. I think the complement to exclusionary discipline is how do we try to prevent feeling as though providers want to or need to use that in the first place. And that comes down to really providing more support and training around trauma-informed approaches for ECE providers. And this graph is from a survey in Connecticut of those receiving trauma-informed training across child-serving systems. And as you see, only 1% are from early care and education. And so there's really a big opportunity and a big need for better supports for ECE providers. And one way that this is really can play out is through infant and early childhood mental health consultation. So many of you may know about traditional health consultants which partner with child care providers around health and safety procedures and standards. And this is a similar capacity building approach where it's not a one-on-one therapeutic service, but it's really about building capacity of child care providers, as well as home visiting programs and pre-K programs to address childhood needs and increase the skills and social emotional competence of programs and services. And some of the other unique aspects of this is it can occur across various types of programs that serve kids early on in life, whether child care or home visiting programs. They're multi-layered in that they have a focus both on individual children as well as at the larger classroom and program level. They're voluntary or no cost to the program or family, and that's because they're funded through a variety of funding streams. And I want to highlight just one of those being Medicaid, and there's really a lot of, I think, good work happening in many states in thinking about how to adapt Medicaid as a funding source to meet the mental health needs of kids early in life. And the other thing is that it works, and it improves child outcomes and staff outcomes and family outcomes and program outcomes. And so there's different kind of policy levers to pull with this, but I think this is really a critical area to explore. One of the biggest challenges is of course trying to grow the pool of infant and early childhood mental health consultants and those who specialize in working with infants and young kids. And I just want to highlight 2 states that are doing really important work in this area, Colorado and Illinois, who are really investing a lot in its mental health workforce and trying to create a coordinated system for infant and early childhood mental health. The last point I just want to touch on is really this challenge around identifying need. And it comes down to screening and how do we identify kids with ACEs, and if so, how do we use that information? And so this is the point of caution, and this is something we as a work group have talked a lot about and wrestled with, and it's an ongoing conversation more broadly. And so, this is a point on some of the pros and cons and things to think about, especially because this has been an area where there has been policy exploration. So California being one of the big examples. And so the proponents of this is right, ACEs screening is really helpful because we have the existing tools to collect it. There's the standard 10 factors. There are surveys to collect the information. And this is really helpful from a research standpoint, a public health standpoint, and an awareness standpoint. Full disclosure, my first 8 slides or so were all based on the ACEs score. But there's the big caution about using ACEs screening as a diagnostic tool or a tool to sort of treat kids. And so I think the caution is it's a relatively crude measure of childhood stress. It doesn't really account for things like the timing of when that trauma happened, the frequency or the intensity of it, the sex differences, how different kids may respond to different types of stress. Doesn't account for protective factors that may buffer sources of stress. And then again, it's based on those original 10 factors, which, as I mentioned, really don't include a lot of really important, and I would argue increasing sources of trauma for many kids and communities. And so I just want to close by really saying that ACEs and trauma are a really important issue. They are common, they impact child development. They're a major contributor to prevailing health disparities. And we really need to move all child serving systems, including ECE, to become more trauma informed. But at the same time, we also need to make sure that, one, the platform that we're building on is a sturdy one. So as Brandy talked about, the integrity of the ECE system, as well as what Kent touched on. It's also about balancing preventing trauma and identifying trauma with cultivating resilience and social emotional development for all kids, and that we remain or retain a critical eye towards the tools and the approaches that we use. So I will stop there and really invite any questions from you all. And before that, though, I do want to say thank you again to Voices and the American Heart Association and Robert Wood Johnson Foundation for giving us the opportunity to really explore this issue in much more detail and think about what are the policy opportunities, particularly in ECE, to address kids' trauma. So thank you.
Thank you, Craig. We'll pause for a moment to see if any questions come in before we move on. Okay, there'll be time at the end also for questions if any pop up. Our final presenter today is Alexis Etu from Change Lab Solutions. Alexis?
Hi everyone, thanks Susan.
Sure.
Thanks for everyone for sticking it out for the last presentation here. I'm gonna go ahead and share my screen. Can everyone see that okay? Yep. Great. So as Susan mentioned, my name is Alexis Etu, and I'm a senior attorney at Change Lab Solutions, where I lead our portfolio of work at the intersection of education and health. And I'm very grateful to be here today and report out about some of the key findings and recommendations from our IEE work group that Change Lab Solutions led, focused on promoting children's social, emotional, and mental health and early learning in K through 12 settings. This work started, I think, almost exactly a year ago in a world that looked very different, and schools look very different as well than they do today. However, many of the issues we discussed and the policy priorities that came up throughout the year, even pre-COVID, have, I think, not only been amplified even more because of living in a COVID world, but have also, I think, just really underscored the need to understand education policy as public health policy, really touched on the importance of health equity and centering that in all of our work, as well as addressing structural discrimination, and also the need for mental health supports, not just for students, but also for educators and adult staff who interact with children on a daily basis. And then also just to mention the health and safety of the physical environment in schools. So real quickly, I'll provide a quick introduction of the work group. I'll highlight the areas of focus and overall goals, as well as the composition of the work group. Next, I want to spend some time recapping some of the key findings and overarching themes that arose in our work group conversations. And then finally, I'll walk through kind of the 8 recommendations that came up as a result of those conversations, which we hope will serve as a springboard for future work in this topic area. But before we begin, I just wanted to acknowledge and express gratitude to the Voices for Healthy Kids team, who with the support from the Robert Wood Johnson Foundation made this work group possible. And then just a quick note for those who may not be familiar with our work, Change Lab Solutions is a national organization whose mission is to create healthier communities for all through more equitable laws and policies. We're a multidisciplinary team of public health lawyers, policy analysts, planners, and other professionals and researchers who work with state, tribal, local, and territorial health departments, other government agencies. We work with other public health organizations, as well as anchor institutions to create thriving communities. And I had the opportunity and honor to lead the work group that I'll be talking about today with the invaluable support from my colleague, Sabrina Adler. Okay, so for context, this work group was created to address crossover issues within the Voices for Healthy Kids early childhood and healthy equitable schools focus areas. Specifically, we sought to explore opportunities to inform Voices' current and future policy levers and campaigns by identifying and exploring emerging issue areas impacting children's mental health. So the main goals and intended impact of this work group are really, I think, threefold. First, we wanted to create a space that elevated key research and identified areas for future research opportunities related to children's social, emotional, and mental health. Second, we sought to help inform Voices for Healthy Kids' evolving policy agenda by providing recommendations for how these issues could be addressed through innovative policies that really lay the foundation for lifelong health and well-being. And finally, we wanted to help build partnerships by aligning interests, strategies, and expertise among work group members. So to achieve these goals, we convened a work group of education, public health, medical, and policy experts from 12 national organizations. I won't name them all here, but have included their logos so you can get a sense of just the wealth and diversity of knowledge of folks who participated in our monthly Zoom conversations. We also invited several guest speakers, including from the Tisch Center for Food, Education, and Policy, as well as the National Center for School Mental Health to speak on related topics. And then throughout the year, we also facilitated a number of one-on-one check-ins with work group members, which were, I think, really instrumental in helping to identify some of the shared challenges, the key themes, as well as the policy priorities, which we use to help shape the agenda and conversation of our larger work group conversations. So there were several overarching key themes and notable findings that arose out of our work group conversations that I wanted to spend a few minutes kind of walking through each of them quickly, but I'm happy to answer more questions about any of these in the Q&A after. So the first kind of finding or issue that came up was around exploring the connections between environmental conditions and children's mental health. We talked about both the direct and indirect effects that environmental conditions in schools have, not just on children's physical health, but also how they impact children's social, emotional, and mental health. This was a huge issue prior to COVID, but it's, I think, particularly top of mind now as schools kind of grapple with what it means to safely reopen schools for in-person learning. Infusing equity into school-based policies and more explicitly into all of Voice's policy priorities was a recurring theme throughout all of the work group conversations. We explored opportunities for ensuring that policies reach and are responsive to the needs of communities who disproportionately experience the highest rates of inequity, including communities of color, low-income communities, as well as rural and tribal communities. We touched on the role of systemic and institutional racism that has led to many of the inequities we see today, and the need to address intergenerational disparities and right historical wrongs. We also talked about implicit bias and ensuring culturally responsive teaching, I think particularly when many educators look different and may not come from the same communities as their students. So thinking about how that might affect chronic absenteeism, exacerbate toxic stress, and further widen educational and health disparities. And then also thinking through the ways that policy might help mitigate this. As a group, we discussed strategies for engaging and building the capacities of young people, impacted communities, and grassroots organizers to advocate for healthy changes. We also talked about parent engagement as a critical equity issue and central component of the decision-making process. Relatedly, we talked about the importance of healing-centered policies and creating learning environments that really center healing, foster protective factors like school connectedness, and build healthy relationships between students, adults, and peers. And I think Craig did a really great job teeing up some of the background for the importance of trauma-informed approaches and just the impact it has on children's mental health outcomes, not just in the immediate term, but also long-term through adulthood. In addition to focusing on the healing-centered or positive approaches, we also wanted to look at some of the harmful policies and practices in schools that are counterproductive to those positive approaches. So a clear example of this being exclusionary or punitive school discipline policies, which Craig also mentioned. And that work in particular is very near and dear to me because at ChangeLab we've been focusing on that for the past few years and really making the health case for why school discipline policies are not just a civil rights and social justice issue, but really a public health issue and crisis. So we know, just to give a quick background on that research has shown that children who have been suspended, expelled, or referred to law enforcement actually exhibit the same symptoms that look just chillingly similar to PTSD. And then also focusing on that negative feedback loop and how defiance or classroom disruption or some of the other kind of quote unquote misbehaviors that are often the result of those exclusionary school discipline practices are often the physical manifestation of adversity and trauma that children experience outside of the classroom that they then exhibit inside of the classroom. So this, I think when we think about it in the context of COVID and the tremendous stress and everything that kids are going through right now, just I think raises a lot of, I think, urgency and importance to really take a closer look at this as we think about the behavioral manifestations of trauma as kids go back to the classroom, whether virtually or a hybrid version or in person. And then something that came up, I think, on all of our calls was around the topic of funding. It's a topic that overlaps with other themes that I've mentioned. For example, many of the inequities that we see in schools, which existed before but have now really been exacerbated even more by COVID-19, are entrenched in historical and racialized policies like neighborhood segregation and inequitable funding formulas. So again, I think this is an especially pressing issue as many states and school districts are facing huge budget deficits and cuts. So thinking about how we can ensure mental health supports are not the first on the chopping block. And then we dedicated one of our work group calls to exploring how school wellness policies, which have traditionally focused on children's nutrition and physical activity in schools, can be expanded to address issues such as social, emotional, and mental health, as well as school climate and staff wellness, and also translated into childcare settings. Additionally, we talked about how successful implementation of local school wellness policies continues to be a challenge for school districts and schools, even those that have created strong and comprehensive wellness policies. And something that we flagged for future exploration is perhaps how we might redistribute some of the responsibilities of school wellness policy implementation, which has traditionally resided with the food service director, but thinking about what other partners might be able to be involved, especially recognizing that nutrition represents just one piece of what contributes to healthy school environments. And then finally, a recurring theme that we wanted to flag for further exploration, which came up and we regrettably did not have time to actually discuss in depth, is the need to design school-based health policies that are inclusive of staff wellness, training, and resources. I think the work group conversations consistently underscored that need to broaden the focus of children's health to also include targeted policies and practices that ensure the health and well-being of adults as well, whether it might be child care providers, school staff, social workers, as well as pediatricians, all of the adults who work directly with children and young people. And again, I think COVID-19 also highlights the importance of this issue, particularly as school staff who've been asked to take on just a number of different roles and responsibilities during the pandemic and school closures are navigating unparalleled stresses and anxieties, both personally and professionally. So just really thinking about what training and resources and supports around social emotional skill building they might need to ensure their own self-care, but also the health and well-being of their students. And then I also wanted to include, there were some additional issues and questions that came up that we didn't necessarily have time to dig into during our short time together, but I wanted to raise them here. They included questions around the role of school-based health centers, especially when it comes to promoting children's mental health, also telehealth and remote interventions, the role of out-of-school time, engaging parents and caregivers, trauma-informed and healing center approaches that are specific to ECE settings, the connections between children's mental health and heal strategies, healthy eating, active living strategies. I think especially as more children and families are experiencing higher rates of food insecurity because of COVID-19, And then questions around data privacy and health information, and some of the challenges when it comes to integrating healthcare and education, especially when those two are governed by different laws. And then here are just the first set of recommendations based on these key themes and conversations that came up. The first one is really just a cross-cutting recommendation, which is to infuse more explicit equity language across policy priorities in both the school and childcare issue areas. The second one relates to updating, strengthening, and enforcing policies that govern public school infrastructure and safety, which have both indirect and direct implications on children's mental health and well-being. The third was around supporting the integration and coordination of services to help address needs related to the social determinants of health, including referrals and access to education, mental health, healthcare, and social services. The fourth was building multi-sectoral interagency collaborations and initiatives to advance the shared goal of ensuring that children have the opportunity to reach their full health potential. And I just want to point out that I think this one is a recommendation that could continue to use some additional refining, especially in thinking through what those specific partnerships might be and what they might look like. And then strengthening local school wellness policies, which can be done through a variety of ways, including ensuring that they go beyond federal minimum requirements to address social, emotional, mental health in schools, both for students and staff, applying them to ECE settings, focusing on implementation, and then looking for opportunities to codify some of these standards in state level legislation. Another policy recommendation was revising state education codes and district level policies related to school safety and discipline, and ensure that they include behavioral interventions such as trauma-informed discipline and restorative practices that build school connectedness, that foster agency and support resiliency. Securing cross-sector funding for social, emotional, and mental health supports and programs in schools. And then finally, prioritizing the health and well-being of adult providers and staff in early childhood and school settings, including staff training and resources to build mental health literacy. And then I've included a series of resources that were shared during the course of our conversations so that you'll have them as well when you receive the slides. So with that, I'd just like to say thank you again to the Voices team for this incredible opportunity, and also just hope that these findings and recommendations that I highlighted today and discussed in more detail in our final report hopefully provide more guidance as Voices and its partners continue to explore ways through which its policy priorities, research, and campaigns can address the pressing health inequities in school and early learning settings. So I'm happy to answer any questions you might have now during the Q&A or even following the webinar, and I've included my email here. Thank you.
Thank you, Alexis. As we wait to see if any questions come in, I just wanted to take a moment to thank everyone for joining us today, and especially thank our speakers, Brandy, Kent, Craig, and Alexis. We appreciate all the hard work and thoughtfulness that went into each presentation. And I just want to remind folks to be on the lookout for a brief survey about today's webinar. Your feedback is greatly appreciated, and it will help us shape all future webinars in this series. So we look forward to hearing what you have to say. We'll just give it another minute and see if any questions come in. Otherwise, I think everybody gained some time back in their day. Nada, do you have anything to say before we close out?
No, I just wanted to thank everybody for joining. I know we lost a few colleagues to another call that was going on, but they will also be receiving the recordings and the slide deck presentations as well. Thank you, Craig, Alexis, Brandy, and Kent as well for me as well. It's been great working with you all, and I know that there's been a lot of thought that went into all of this work. We truly appreciate it, and your recommendations you made during our policy agenda changes for this next year. So thank you everybody for joining us, and we'll give you some time, like Susan said, back in your day. I'm sure that you will appreciate that, and if you have questions, please follow up with us.
Thank you.